Hello, today we'll talk about ECU injuries, extensor carpi ulnaris injuries in tennis players. Okay, so what is an ECU? ECU tendon is a tendon that runs through this side of the wrist on the little finger side. It comes here, runs in a bony groove and attaches here. This is the function of this tendon is it helps in extension of the wrist, but it also stabilizes the wrist when the wrist pronates, as in like this, and supinates as well. So we notice this injury a lot in tennis players, especially when they're trying to impart top spin to their shots. They may present with a simple enough discomfort here, and sometimes when they're playing a double-handed backhand, they may have a sudden pain on this, the hand close to the racket head. They can have a sudden severe pain which can lead to rupture of the tendon. Sometimes this hand is also involved when playing the backhand. The pain will be very intense and they may not be able to play for a few minutes. And then even if they get back to play, it may not be as good as what they were doing before. And the other presentation is the tendon. There's a tendency for the tendon to slip in and out of the bony groove here. Here is a bone model, and again the tendon runs through the bony groove here, and sometimes the sheath over the groove can detach, and that can lead to the tendon slipping in and out. So these are the common clinical presentation of an ECU tendon problem in tennis players. It's really important to take heed and notice and go and consult a sports medicine specialist if this happens. For example, if it is just a tendinosis, wear and tear of the tendon, just simple rest from activity, modifying your shots from topspin to flat shots, strengthening the tendon usually helps, and sometimes injections, biologicals help, and very often splinting also is helpful in these situations. In other instances, if the tendon is slipping in and out, it may need to be immobilized for 2 or 3 months. Rarely, if that doesn't help, we may have to stabilize it surgically. Almost invariably, when a tendon ruptures, it has to be explored, repaired or reconstructed with another tissue to recreate the sheath. And then immobilization after a month or 6 weeks, and rehab allows the tennis player to get back to his game. So more importantly, how do you stop that from happening? Of course, learning to play tennis properly under proper guidance, refining your strokes with the help of a coach. If you have a problem, to consult early rather than late, and if you have to rest your wrist for a few weeks, then so be it. You can always come back stronger and make sure you don't have a long-standing problem of your ECU tendon. Hope that helps.